complete the detox here, and if you can then either stay here for rehab or somehow stay clean for 7 to 10 days, you can receive the first dose of naltrexone. And once you receive that dose, if you take the pill form, for the rest of that day you'll be unable to use an opioid. If you use it, you won't get sick or anything, it just won't work. It will, like, your body will just metabolize it and excrete it. And then if you continue to stay on naltrexone, you're essentially blocked from the ability to use opioids. Now, unfortunately, naltrexone doesn't block benzodiazepines, and I know you mentioned the Xanax, of course. So that's why I think we want to be really careful when we talk about your treatment plan, because it sounds like you're actually dealing not just with an opioid use disorder, but also with a sedative use disorder.
Yeah, but I feel like it's not that big of a deal, right? It's not that much, is it?
Well, it's quite a bit. In fact, Xanax, or it also goes by the name alprazolam, is a dangerous medication. One of the uniquely dangerous things about it is that it can sedate you at the same time and in a different manner as heroin can. So, for example, we've got different systems in our body. We have different receptors. And the Xanax can hit one receptor, and the heroin can hit a different receptor, and we can find ourselves almost doubly sedated, and in some cases almost dying, like what happened to you.
I just feel like I can't give up both at once.
And why is that?
I mean, I guess it's about why am I doing it in the first place, but I feel like the Xanax really helps me.
Okay. Xanax is a short-acting benzodiazepine. Of the benzodiazepines, it's certainly the most dangerous one. So if you are going to continue to use benzodiazepines, I would definitely recommend taking one that has a lot less abuse potential and is a lot longer acting. And we can talk about what some of those are. I don't prescribe them, and again, my recommendation is that you not continue them. We're going to give you a tapering dose of the benzodiazepines to get you off of them. But if it is something you decide to use, we can talk about what some of the safer benzodiazepines are for somebody like you. If you're not ready to give up the benzodiazepines, perhaps it makes sense to really talk about the opioid agonist treatment so that you can at least have some stability and you can, work on the benzodiazepine issue over time.
So you mean the first one?
The first one, yeah. Remember, and those come in sort of two forms of the opioid agonist treatment. There's a medicine called methadone, and then there's a medicine called buprenorphine. I think you mentioned you had heard of the buprenorphine.
Yes.
Okay.
So I don't know. What do you think, Doc?
Well, I get that question a lot, of course. I think you said it best, right? You don't want to wake up on the floor again. You want to get on with your life. You want to be a psychologist and get back to school. So if it were me, I would recommend going on opioid agonist treatment. You've been using your drugs for too long. I think you should use our drugs for at least a year, right?
1 year?
Well, I think psychologically, let's get your head wrapped around the idea of 1 year, and then after that, we can talk about, what your plans are and how you're doing. I mean, to be honest with you, Danielle, this shouldn't be a year where you just take buprenorphine or take methadone and don't do anything else with your recovery, right? You can consider the buprenorphine or the methadone a small percentage of your recovery package, right? I want this to be a busy year.
So
you need that tool belt.
What's different than when I left Detox 100 other times? Or at least 5 other times?
It's a good question. Well, hopefully a lot this time. It doesn't sound like they mentioned medication-assisted treatment to you on the last detoxes, or if they did, maybe
I gotta say I wasn't asking. I was dying to get out of there.
I understand.
But,
yeah.
I don't know if they did or they didn't, but I don't remember it.
Yeah. What scares me, Danielle, what keeps me up at night is when people leave detoxes and they're here, they're motivated, and then they leave and one thing leads to another and they relapse. And what particularly scares me is that a lot of them die. It sounds like you've had some friends who have passed away.
Yeah, I gotta say, in Staten Island, it's kind of crazy.
It sure is. It sure is. You've known some folks who've had some overdoses.
Certainly people from my high school.
Is that right?
Yes.
Scary.
I don't want that to be me.
No. Me either.
I don't quite know what to do different.
Okay. Well, I mean, I can tell you definitively, when we look at the data, when we look at literature that's out there that's published about these things, we know definitively that people who engage in medication-assisted treatment are far less likely to overdose than people who are not engaged in medication-assisted treatment. Okay, so when I think about keeping patients safe, I oftentimes mention medication-assisted treatment so that you can get your dose of opioid and get on with your day, right? You're not having to use multiple times per day. I mean, how many times per day are you using heroin? Probably every couple hours.
Yeah, it's like, yeah.
It's a nightmare.
Not more.
It's a
every hour and a
nightmare.
half.
Right. So you're in this sort of continual cycle of pain, this continual cycle of probably anxiety about where you're going to find the next dose, and wasting all your money in order to do it. So,
stealing and selling and borrowing and taking.
Yeah.
But so how does this work? I don't get it.
Okay. Okay. So what I'd like to do is actually have you seen by our opioid treatment program, right? So I'll have one of the staff members come and talk to you about the program specifics. It's right here in the hospital, of course. And if you're interested, we can enroll you today.
Today?
Yeah, absolutely. There's no reason to continue a detox and put you through all the pain associated with the detox. If you're interested in engaging in this treatment, we can start you on it.
I mean, I'm certainly willing to try.
Good.
I don't think I have anywhere to go if I don't try.
Well said. I think it's important that whenever we talk about a plan, we should make it a plan that's informed. We should use the past experiences and try to let it inform us about what our future plan should be. And in your situation, it sounds like we've tried a few times, or you've tried a few times at what we call an abstinence-based approach, and it just hasn't worked. So let's try this way.
And can you talk to my parents?
Of course I can.
They're so sick
of course
me.
I can.
I know they care, but
yeah. So one of the things I'll talk to them about is opioid agonist treatment, and I'll explain it to them the same way I explained it to you. One of the questions they'll probably have, or one of the questions that you may have, is like, can you go back to work while you're on opioid agonist treatment? Absolutely, okay? You can go out, you can work, you can do whatever it is you want to do.
And people won't know I'm on it? Or?
No, of course not. It's 100% protected information. This is between you and the clinic that's giving it to you. And hopefully that's us, or if not, we'll find you a different clinic. But nobody can know that, nobody has the ability to know that you're on it. It's up to you, of course, if you want to share that, but it's not something that your employer can find out about.
Okay. All right, let's try it.
All right, excellent. Well, thanks for talking to me, Danielle.
Thank you.